You just heard Roseanne say Chicago seniors can now sign up for vaccinations at that mass site. A total of 110,000 appointments have now been made available on the ZocDoc website. So joining us this morning with more on this vaccine megasite is the director of the Illinois Department of Public Health, Dr. Ngozi Ezike. Good morning to you, Dr. Ezike. Nice to see you.
Much for having me.
Well, this is an exciting morning. You probably just heard Roseanne say a lot of confusion. People are already heading out there thinking today's the day, obviously very excited about being able to get this vaccine. And I know that it only opened at 8:30 as far as registration goes. What do you know so far about how it's going?
Well, I know that I think there may have been a small glitch, and I think it started a few minutes after 8:30. So I know the people who are probably trying to hold on for 8:29 experienced a tad bit of a delay. But I know I've heard from the team that it is up and running, and I think we're moving along now for the last just few minutes.
It is very exciting that this is happening, and it's going to be reaching so many people. I know that's been a big push of you guys to get our most vulnerable vaccinated. How is this going to make that possible?
Well, just the sheer volume of the vaccine that is being provided by this federally supported effort. You know, this is above and beyond the allocations that are given to Chicago and to the state of Illinois. We're getting an additional 6,000 doses per day. So that is just a very significant amount of doses. And of course, we are prioritizing at the outset our most vulnerable populations in terms of age, which are our seniors. And so having this early registration time that's open to seniors first to really give the seniors the opportunity to get that is important. And of course, just the location. That location was very intentional. We wanted to put it in an area that would reach without barriers our underserved populations, a large minority population. We know how the Black and Brown communities have been disproportionately hit by this COVID. So being able to find a very good central location, great access via different transportation routes, a very well-recognized location that most people are very familiar with. We think that that will help drive the populations that we need most to this site.
And this is just one of many, because yesterday the state announced 2 more mass sites, one in Des Plaines, the other in downstate Quincy. How many people do you hope to vaccinate a day, a total with these locations? Because I understand over the past 7 days, the state's daily average has been around 84,000. With these new sites, are we going to see those numbers double, or what's likely to change?
Right. So some of the other sites may not come with vaccine. And so, you know, the 6,000 per day at the United Center really will help augment and increase that daily running average of vaccine. But we are hopeful. We keep hearing that production is being ramped up. Every day we get more promising news about how more doses will be coming into the state. And so not only the mass vaccination sites, but we also have more vaccines coming directly in from the feds to local pharmacies, you know, throughout our state. So, you know, I don't want to put any predictions out because I'll be held to them. We want to keep ramping up and make it to the point where the vaccines are falling out of the sky and, you know, we're begging people to get it. And we are hoping to be in that situation in less than a couple of months.
Less than a couple of months. That's important to note. Also, you brought up a really important point that was also brought up in the news conference last week when this site was announced, and that is that the vaccinations you are getting for this mass site are above what we are already getting for these other clinics and pharmacies. And so a lot of people have been hearing, we reported yesterday that Johnson & Johnson might be part of the vaccines that will be given at the UC. I know Pfizer is the other one. What is the situation with that, and what do you want people to know?
Right. So we do at some of our other mass packs, definitely at the site in Quincy in Adams County, they will be getting Johnson & Johnson there. At the UC, at the United Center, that will be Pfizer, unless there are any changes. The White House has told us that that would be a Pfizer vaccine that would be administered there. So it will still require people to ensure they come back for that second appointment, which they will get at the time that they present for their first. So it's very important that you still remember there are 2 doses with the Pfizer vaccine that will be administered at the United Center.
So here's a question I bet a lot of people are going to ask. So they will be accompanying someone who qualifies right now to get a vaccination, and maybe they're accompanying that person hoping that if they get there and there's any leftover vaccine, that they might be able to take advantage of that. I think this is a genuine question, and I was hoping maybe you could address what's going to happen with this so people aren't disappointed.
Yeah, so on the one hand, we know that the uptake will be very high. We're not putting appointments out for the whole 8 weeks, just the first couple of weeks. And so we think that there will be a high show rate. But of course, things can happen. You know, a ride may not come through. Maybe something will happen where somebody can't come. So we are developing a wait list for the end of the day. And so those individuals will be noted, will be notified so that they can know at the end, you know, towards the last couple of hours of each day, those people, we can work down that list and get those people in. So, you know, we definitely don't want a single dose to be wasted. And so we definitely have a contingency plan to get some others in to make sure we use up all those 6,000 doses each day.
Oh, I'm so glad we brought this up because I think a lot of people are going to be interested in hearing that. So if they sign up through ZocDoc and they don't make it for that first day, they might be able to make it on the wait list depending on where they signed up, right?
Right.
Okay. Finally, I'm curious if there are slots open. Let's talk about what happens at this, because obviously you're giving priority here to those who need it the most. But if it's not filled up by Sunday at 4, which is I think the goal, right? Walk us through what happens next so people will know.
So then we will open it up to all eligible individuals. And reminder that the eligible individuals now are all those in 1A, 1B, and the 1B plus. So of course, if there's still any healthcare workers that need to be vaccinated, if there are any of the essential workers that were previously defined, our frontline, our first responders, teachers, you know, there were people with the medical conditions. So now all of those individuals will come into play and will be able to try to get an available appointment after that Sunday, 4 p.m.
Okay, a couple of more questions for you. Right now we have the United Center vaccine registration call number on there, which I think is important for people to know. You guys did that on purpose because not everybody can go to the website. So there's the call center number right there. There's the hours of operation. And of course, there's the ZocDoc. So you're trying to make it as easy as possible for everybody. Curious if your call center has been overwhelmed. What can you tell me about that?
Right. So we did, I think there are about 200 operators, but I can imagine that the volume will far exceed that. What's really great, because we know, you know, the appetite is heavy. People are hungry for this vaccine. Many people will have some tech issues and need to talk to a warm body. And so even if we can't, you know, obviously we'll have more than 200 individuals calling at the same time, there is an option to leave your information so someone can call you back. So you don't have to sit on hold for hours, but can wait for someone to call you back to give you that assistance.
Okay, wow, this sounds like an incredible undertaking with the call center and the ZocDoc, and so hopefully everybody will be able to take advantage of it. But finally, I just want to get your reaction to the news that Texas and other states are now removing these mask mandates. Is Illinois close to making those same changes? Because you know, our positivity rate right now is the lowest it's been since late June. So we're doing pretty good, wouldn't you say? And is that going to have an effect on the mask mandate? And how do you feel about that?
No, I understand that people have grown into a love-hate relationship with these masks, even though they are so critical. We absolutely are looking forward to the day that we can say, you know, we are beyond the point that the virus in our community is so low that our chances of running into someone with the virus is so low that masks are not even needed, you know, compounded with the fact that many people are vaccinated. We're not there yet. We're really not there yet. And we could I mean, we did this already. We've seen this movie, we read this book, we got down to those low rates that you cited in the summer, but there was enough still to ramp up again. We don't want a third wave before we get to the end of this pandemic. And we are so close. We didn't have vaccine in June. We have it now. So we just need to be I hate saying this word because people have been patient for a year, but we still need just a few more ounces of patience. We're not ready to get rid of our masks yet. It is one of the key pieces that will help us more quickly get to the end of this as we're ramping up these life-saving vaccinations.
Dr. Ngozi Ezike, what a pleasure to speak to you this morning. Hope you come back and visit us and let us know how things are going. We so appreciate your time. Have a great day.
Anytime. Thank you so much.
Okay, good to see you.